Thank you, Andy. So first of all, hello everyone. Good afternoon from Bali, Indonesia. And first of all, I would like to say thank you so much for inviting me in this very great and inspirational event. My name is Idewa Agung Ayu Shinta Dewi, but you can call me Sinta. And yeah, so answering the any questions. In Indonesia, the topic of like menstruation remains a sensitive issue and often surrounded in stigma, cultural taboos, and misconceptions, especially those who live in rural areas. Like the discriminatory practices include restrictions on participation in religious activities, myth about hygiene and limited space or limited discussion about menstruation, also lack of education, lack of comprehensive education about menstruation, and also lack of supplies, menstruation supplies, which reinforce shames and silence. And through what I and my team been working in Girls Like Indonesia, we have successfully implemented our programs such like first is we are doing like a massive socialization to schools and to the society. We're giving educations. We've been educated around 2,000 young people in school setting and public settings. We empower our theme that is still in junior high school and senior high schools. Also they who already in university students to be peer educator. And I think this approach has proven impactful outcomes. We are successfully create discussion and safe place to talk about menstruation confidently. We also included and educate boy and man about this topic because I do realize that their role in breaking the taboo, stigma, and discrimination is one of the important efforts that must be considered, where they will become further and in the future with a repetitive cycle that can certainly imagine. And the second one is we are successfully making collaboration with the schools and local communities, and we also involve government in our project to be talking about the problem in like menstruation issues in Indonesia, especially in Bali. And we are also successfully engaged more people from social media as I saw that our social media is increasing, and we heard that a lot of their positive response about our project in Indonesia, either from the teens, government, and the local and national um, government in local and national levels. And one of the proudest achievements has been seeing our trained youth leader take the initiative to organize menstrual health campaigns in their schools and communities. For instance, several schools have introduced basic menstrual hygiene education and improved facilities after sustained advocacy by these young leaders, by our members. And another success stories is that we are engagement of male allies in our programs, helping to challenge stereotype and support gender equality and menstrual health advocacy. And yes, just like Andy said, like there are challenges despite this success, as that I've always saying in every opportunity that in order to dignify menstruation, we need support from everyone. We need access to menstrual products, comprehensive menstrual health education, improve facilities like proper toilet and water sanitation and hygiene management. And I know there is like the WHO lately recently reported that around 8.9 million children attend schools with inadequate sanitation facilities. However, toilets support the progress and help us dignify menstruation at school, where periods usually start from school children who have reached puberty. And also, I read about the research that is reported by UNICEF Indonesia. They found that 25% of adolescent girls in Indonesia have never discussed about menstruation before they had the first period, first menstruation. I mean, and the 17% of them didn't know that they were menstruating, which mean like it's a very sad. And when we talk about policy in Indonesia, as what I have known in Indonesia, we don't have any policies that is specifically talk about menstruation. However, there are some existing laws and policies related to reproductive health and sanitation, but still, it's not strong enough, and we need to advocate more on these things. And but despite all of those challenges, we do see many opportunities. Like we um, can make collaboration with schools. They are like now openly discuss about SRHR and menstruation specifically, and yeah, also, last thing that I wanted to talk is like promoting dignified menstruation is about to ensuring every menstruator can live with a dignity, free for stigma and discrimination, and with full access to their sexual and reproductive health. This is a fight for equity and justice, and I am committed to being part of this transformative journey. Thank you, Andy.